I started out as a painter and artist. I went to medical school later in life at the age of 40, and I have no regrets. It was exactly what I was meant to do. I was really excited to start my own practice by the time I was looking for you. I had been working for about a decade as a medical director of addiction treatment programs in northern Vermont. I was really feeling called to offer a more integrative and comprehensive treatment for my clients. I felt
Mhm.
like I wanted to create a practice where I could really show up fully and not feel constricted by shorter appointments or needing to
Mhm.
see 25 patients in a day. After finding your program online and listening to some of the things that you were talking about, it really felt like it was aligning well with my dream vision for what would
Mhm.
I like to do now. I felt like I was ready to begin working in a way that was more creative, that gave me more freedom, not just with treating my patients, but also more freedom to have a cup of tea, more freedom to walk my dogs with my spouse. By feeling more fueled by my days, by getting my needs met, I recognize that I was able to provide more for my clients. It all feels like it's flowing in a much healthier way because I was frankly working way too hard before and it wasn't sustainable. One of the things that I've been telling people who I recognize may be in a similar boat to me is we are not renewable resources.
Yeah.
And the system treats us like we are inexhaustible, and that is not the case. I realized that doing what I did was respecting myself, and that
Mhm.
fundamentally, if I'm helping my clients to respect themselves, I have got to walk the walk. And that
Mhm.
is what I stepped into respecting my own needs more fully. I was so conditioned
Yeah.
to keep going. That mindset of, I can do it. This is tough, but I can do it. And that it was like an aha moment of, wait a minute, the work is the problem?
Mhm.
Working too much is the problem? I have such a patient-centered practice. My clients can reach me by email, they can text me. I have flexibility if someone's in crisis to see them. I didn't feel as though the systems were set up to be patient-centered or
Mhm.
physician-centered. And that's why I went to medical school. I was interested in what it meant to heal. What I've created for myself and my clients is healing. Thanks to you.
I
Hi,
appreciate.
Sue. Good to see you. Thank you so much
So
for doing
nice to
this.
see you too. Hi, Ilana.
So let's start off. Let me just introduce myself for people watching this. They probably know who I am, Dr. Lana Miller. I'm a psychiatrist and I have my own private practice, but also teach other psychiatrists how to start their private practices. Why don't you give a little brief intro for people on who you are?
I'm Dr. Sue White. I'm an osteopathic physician. I'm a psychiatrist, and I'm also board certified in addiction. And I have my own practice here in Vermont.
Excellent. And so let's go back because we were just chatting about this before we hit record. You were one of the OGs in the program back in 20 like March of 2022. I just started I think in 2021. So where were you at when you like how did you even come across my stuff? What made you even like consider it at that point?
I was doing a little exploration of what do I want with my life? And let me just type it into the internet and see what pops up. And I knew I wanted an integrative psychiatric practice. And I just typed in something like start your own integrative psychiatric practice. And you popped up. And there was
Hmm.
a some sort of module, and I said, I like this. I think
Hmm.
this is interesting. And then I ended up talking to you shortly after
Yeah.
that. Yeah.
And tell people because your background is so interesting. Tell people a little bit about like your professional background because medicine was a second career for you. So what how you even got from what you were doing to medicine and then what you were doing like job wise, professionally wise in March when you came across my stuff.
I started out as a painter and artist. I went to art school and I got an MFA, and one thing led to another, and I became curious about going to medical school. And I went to medical school later in life at the age of 40. I had been a designer for the gift industry and I'd been selling my paintings in galleries, and this was a really abrupt shift, and I have no regrets. It was exactly what I was meant to do. And I was really excited to start my own practice by the time I was looking for you, because I'm a creative person. I'm a little bit of an outside of the box thinker. And
Hmm.
I had been working for about a decade as a medical director of addiction treatment programs in northern Vermont, and felt that had been a really great experience. I was super glad I had done it. And I was really feeling called to offer a more integrative and comprehensive treatment for my clients. And I felt
Hmm.
like I wanted to create a practice where I could really show up fully and not feel constricted by shorter appointments or needing to
Hmm.
see 25 patients in a day. And after finding your program online and listening to some of the things that you were talking about, it really felt like it was aligning well with my dream vision for what would I like to do now. I felt like I was ready to begin working in a way that was more creative, more that gave me more freedom, not just with treating my patients, but also more freedom to have a cup of tea in the
Yeah.
morning, more freedom to walk my dogs with my spouse. And so to create a schedule that worked for me, and by feeling more fueled by my days, by getting my needs met, I recognized that I was able to provide more for my clients.
It's interesting for psychiatrists. I feel like most people that really want to do private practice, like we can make good money just getting a job. And if you want to just make good money, that's probably the faster way to do it. But I think what drives us, like psychiatrists, to do private practice is more the autonomy and the control and being able to do it our way. Like you said, I want to take a tea break in the middle of the day. I want to
Mhm.
be able to walk my dog at 2 p.m. and not have to be like at some office and my corporate overlords are telling me what to do or whatever. Tell people a little bit about your, like, you had already done some really interesting things in terms of integrative medicine prior to, like, when you were working as a medical director or prior to even coming across my stuff. What was your, tell people a little bit about that part of it, like the Aboriginal Yaqui elder work and all that.
I've been really curious. I've devoted the last 30 years of my life to understanding what it means to truly heal. And that's just it became a passion, and I became so curious about what are the answers? I joke sometimes to people that I went to medical school as a spy because I wasn't 100% convinced
That's funny.
medicine had any real answers, that it was
Yeah.
treating symptoms. And then after I went to medical school, I went, ooh, okay. There is something I like to call the genius of the and that I took from positive psychology. So I was like, yeah,
Mhm.
genius of the and. There are some really useful things here in medicine, and medicine doesn't know everything. There are
Mhm.
people that have been around for a long time that have figured out what it means. And I went to school to become an osteopathic physician on purpose because I believed in the tenets of osteopathy. I believed that it was really important to treat the mind, the body, and the spirit. I believed that the body is capable of self-healing, and by extension, so is the rest of us. So
Mhm.
I went on a search in a lot of ways to find, what does a kura do? What does
Mhm.
I met this Yaqui elder, and it was a long story how I ended up meeting him, but the gist of it was that I was treating addiction, and I found a woman who had been using heroin, who told me she'd gotten off heroin, and I asked her how, and she said her friends had dropped her off at this old Indian guy's house.
Oh, interesting.
And she spoke to him for 3 days and never used again.
That's
So I
fascinating.
said, okay, I'm calling. I want to see
Okay.
what he did. And
Yeah.
I
Wow.
called him, and I realized when I started working with him that my nervous system felt different, that there
Mhm.
were things that he was teaching me that I felt were a beautiful complement to what I had learned in Western medicine. And then
Mhm.
along the way, as an osteopath, we learn how to diagnose and treat with our hands, and you can start to feel differences in people's nervous systems or differences in their primary respiration and other things that I won't get into that's very
Hmm.
osteopathic. But somebody gave me a book about healers, hands-on healers in Australia. And I became very curious about that. And I thought, what are they doing? And so I became a little bit obsessed with meeting a Nunkari healer in Australia. And I went to Australia, but I wasn't able to connect. So I came home and got a call. Somebody said, I heard you wanted to meet a Nunkari healer, and I've got one who's willing to talk to you. And I wasn't expecting this, but they were able to Zoom with me.
Oh yeah, I wouldn't have guessed. That's
And
interesting. They
then
got technology too.
I didn't expect that at all. And they invited me to go to the outback of Australia and to go on a tour with
Hmm.
them and a handful of other people to go to sacred sites and experience things there that were also very enlightening and
Hmm.
also helped me to understand this is important and this is a lot like what this other indigenous elder is saying, and these people are on other sides of the planet and they're saying
Yeah.
similar things. And I love the genius of the and. What can I take from these experiences that I can bring to my clients in a way that makes sense to them? And what I found is that it's really important to understand what paradigm people are coming to you within. Because if
Hmm.
somebody is coming to you and they say, I really need medications, say, okay, I can do that.
Yeah.
If somebody is
Hmm.
coming to me and says, I don't want medications, okay, let's see what we can
Hmm.
do. It's keeping in mind that safety is
Yeah.
and making sure I like to follow standards of care. Make
Mhm.
a lot of sense and at the same time I like to bring extra. So
Sure. And also,
yeah,
like I when I do these workshops like every couple of months, I'll do a night on integrative psychiatry. And I love this slide that I always come back to, which is that the patient's belief in what will work and our conviction in what will work is
mhm,
more determinative of outcomes than
sure.
using a medication. Like
Culture bound syndromes,
exactly.
absolutely. Yeah,
Hmm.
yeah. And I love that. And I do find that people in general, and I don't know if it's where I live because I live in Vermont and people are pretty open. A lot of people who are coming in are interested in growing. And you know that my email address is
Hmm.
grow@tamarackpsychiatry.com because I feel like there is nothing as noble as healing and growing as a person
Hmm.
on the planet. Yeah, so this is my dream, and you helped
Hmm.
me achieve
Yeah,
my
yeah.
dream. And I'm sitting in this really beautiful little office in a little building that I purchased a couple years
Yeah.
ago. That now I have a couple other people who are in the space, who are excited to be in the space, working alongside of me in their own practices, but we all enjoy touching base with one another.
Hmm.
And I have two offices. I have one closer to my house, and I have this building, and everything is just it's just great. And I was talking to somebody saying, for a while, I kept thinking I'm pinching myself. I'm getting
Hmm.
up. I'm doing, I went for a bicycle ride before work, and I had time for that earlier this week. And today I got to go to this really great place to have lunch with my spouse, and I'm still
Hmm.
working, and it all feels like it's flowing in a much healthier way because I was frankly working way too hard before and it wasn't sustainable. And one of the things that I've been telling people who I recognize may be in a similar boat to me is we are not renewable resources.
Yeah.
And the system treats us like we are inexhaustible, and that is not the case. So I realized that doing what I did was respecting myself. And that
Hmm.
fundamentally, if I'm helping my clients to respect themselves, I have got to walk the walk. And that
Hmm.
is what I stepped into respecting my own needs more fully. And yeah, and I was talking to a
Hmm.
client and she said, oh, thank God I'm working with you now when you're
Yeah, yeah.
happy
Uh-huh.
versus when you were being asked to see. At one point, somebody said, you're going to have to see 36 patients a day. And I said, you need to go back to the drawing board and rework that because
Oh
that's not going to
God.
happen. But those were the pressures of the
Yeah.
systems that were
Hmm.
just not working, or hearing messages like, you're doing too much for the clients. This isn't
Hmm.
workable within our system. And I'm going, wait a minute. I need to be, yes, I'm treating addiction, but there's this underlying serious bipolar disorder or trauma. I need to address that as well, or in a more holistic way. So this is, yeah, I've landed. I've just landed.
Let me ask you, because I remember when you joined, you were on the fence and you ended
Yeah.
up deciding to do it. And then I forget how long after, but at some point you sent me this really nice email that was like, you rock, this program rocks. What
Yeah.
was it? Like, what in the program helped make things click for you or helped to make this possible for
Yeah.
you? What were the parts that helped you?
I came to this all later in life. I spent years as an artist in a studio. I did not feel 100% confident about the systems that I needed to put in place. I didn't feel 100% confident about being savvy regarding what EHR do I need? How do I set this up business wise? And once I met you, I went, oh, she's got this. She's what
Thanks.
she's doing with all this stuff. You had done all the legwork, and I frankly didn't want to do.
Yeah, sure.
I
Yeah.
wanted to be out in the desert in Arizona or Australia or learning something that I could apply in my practice. And I didn't want to do the business side of things from scratch.
Yeah.
I don't mind showing up. I do
Hmm.
have some entrepreneurial impulses, but I needed somebody to show me the way, to feel a little bit confident that I wasn't stumbling in the dark, blindfolded as I'm trying. I didn't want to reinvent the wheel. I was like, oh my God, she knows how to make the wheel. She's got the wheel.
Yeah. Thank
Let me
you.
just jump on. Let me just jump on here. So yeah, I was a little bit hesitant in the beginning because I was like, whoa, I got to do my website. I got to do this. I got to do
Yeah.
that. And in the end, I was just 100%. I found you at exactly the right time. I was ready to
Mhm.
launch and you just got me there.
Yeah, I always like I love setting up the systems, like the business side of it, because like you
Mhm.
said, we didn't go into medical school to learn the business side, and we didn't learn the business side in medical school or in our medical training. But I think that's what keeps us stuck in these systems that tell us
Mhm.
see 36 patients in a day. Because if you
Right,
don't
right.
know the business side, then you feel like I have to do this. This is like the alternative feels scary or overwhelming. And I like demystifying of that. No, this is what they don't want you to know. It's not that hard if you
Yeah.
follow a roadmap or a system and you're not like trying to figure it all out on your own.
It totally reminds me of a story that my friend, grandfather Lynch, told me about a boy who finds a flea and puts it
Hmm.
in a jar. And it's a jumping flea, and it had been jumping very high jumps prior to being put in the jar. Once it's put in the jar and the lid is put on, the flea jumps and hits its back on the top of the jar. And so the boy's walking with his grandfather, and the grandfather says, I would like you to put the jar down now and take the lid off and watch what the flea does. And the flea, the boy's looking, and the flea is now jumping. It's completely capable of leaping out of the jar,
Yeah.
but it's now conditioned to jump only so high. And I feel like that's what the system is capable of doing to a lot of physicians. Keeps us trapped in the jar, and we don't realize we can jump out.
Yeah. And then what I love too about your story is that not only did you start this practice, but it evolved into this whole other dream of like you purchasing this office building. Let's say a little bit about that. You said it, but maybe even slow down. So you started your practice, you started seeing patients, but then how did it transform into now this more larger thing that you've created?
It organically morphed where I was in one location that was a little bit closer to where I live. And this other location was a place where I had been going for years to work with osteopaths there as a client. And because of the work I had done while I was here, I had gone to medical school. So when the woman who was running this building decided to retire, she came to me and said, it makes sense to me that you're the person who would be the steward of
Mm,
this
that's so
place.
cool.
And I said, no, you must be on crack. I'm not doing this. I'm not taking it on.
That's
And, uh,
funny.
and here I am.
Resistant at first.
What's that?
You were resistant at first.
Apparently, that's my MO.
That's
Anything worth doing is apparently worth questioning. So I question it hard,
yeah.
and here I am, and I absolutely love it. I ended up following my heart. The whole thing has been about really listening, listening. Is this something you're willing to take on, and you can do it? And today is exciting because I haven't gone downstairs yet to see. I finished this first floor. I'm in a room with a skylight and multiple windows, and it's a wonderful room with wood walls. And the downstairs was just finished today.
Oh, amazing.
The fellows just left, and I get to go down and see the floor that they just put in the
Hmm.
downstairs. So now there's phase two for the downstairs is about to start.
Oh, amazing.
Yeah.
And
So
then you full time in your practice or part, I think you want a part-time practice. Do you still work as the medical director part-time or are you just full on in your
no,
practice
I
now?
am full on Tamarack integrative psychiatry with my two locations now.
Okay.
Yeah. And I don't have a lot more room to take people on at this point
Hmm.
because frankly, I travel quite a bit.
Hmm.
I just don't have a lot of room because I'm enjoying my life. And
Hmm.
I've made some decisions about this is all I can handle at this point.
Yeah.
The fact that I'm taking off frequently and doing other things.
Sounds like a nice lifestyle. You're like, I got places to go. I've got trips to go on. I got
Yeah,
my dog to walk.
I got things going
I can't
on.
see your 36 patients a day.
No, I don't have I don't, there's no way there's 36 patients. And the patients I do have, I feel like I can give them so much more than I
Mhm.
ever could in the system.
Let me ask you, because it's interesting. I mentally don't understand why people don't want to do a practice. I literally like have trouble comprehending. So I have a hard time
Yeah,
when I'm talking to people considering joining the Dream Practice Academy. Oh, almost like a hard time overcoming the objections because I don't understand the objections. Because I think what a lot of psychiatrists feel is it feels too much of a leap. Like, especially if you're making good money and you have the benefits or whatever, it's like the golden handcuffs. What would you say to
exactly.
the psychiatrist watching this who has the golden handcuffs? Who's, I don't know, this is good enough.
I would say it's only your health and well-being.
No, just a little health and
It's
well-being.
only your health and well-being. That's what I would say. And it reminds me, I was working with the elder, a Yaqui elder, and he asked me to do an unflinching inventory of what I do, what I was doing every day with my time, which is all we have. And I was a little bit embarrassed to say, oh, sometimes I do scroll on social media and I put it
Hmm.
down, and sometimes I do maybe go shopping for new boots or whatever it is, stress. So I'm writing everything down. I'm being so honest and
Hmm.
I'm putting it down and then work. And I was working a lot when I first went to see him. So I gave him the paper. He looked at it. He said, "You have a pen?" I said, "Yes." He said, "Because I see what the problem is here." And I thought, oh, he's going to judge me for the frivolous things I do in my free time. And he took the pen and I couldn't see, but he put a big X in something and I couldn't see what the X was in from where I was sitting. And then he turned the paper and he pushed it gently across the table back at me and he said, "You work too damn much." And I
Yeah.
and it just hadn't occurred to me that was a problem because I was so conditioned
Yeah.
to keep going that mindset of I can do it. Yeah, this is tough, but I can do it. And that it was like an aha moment of wait a minute, the work is the problem?
Hmm.
Working too much is the problem? I was going to stay to be the last one there to make sure
Yeah.
that I was working enough and that I was and I was like, what who taught me to be so
Hmm.
unhealthy? The system
Yeah.
taught me that I was supposed to do that. The system taught me that I was supposed to show up when I was sick. The system taught me that I was supposed to wake up in the dark, work until it was dark, go to bed, and get up and do it again the next day, the same way. The system taught me that I was supposed to get by without enough sleep. The system taught me that I was supposed to miss lunch if somebody else needed me or there was a meeting, that I wasn't supposed to have downtime. And that system was not healthy for me. And I don't think it's healthy for a lot of people.
Yeah, that's really powerful. And the thing is, it's like the frog in the metaphorical bucket or
Yeah.
pot of water where it's slowly getting worse. That it just it seems like every 6 months, every year, like more restrictive contracts, more patients you're expected to see in an hour, more like more systematic changes or systemic changes that make it harder to leave. And does take a little bit of a leap to leave. And I think like when you're stuck in it, it can be easy to have the cognitive dissonance of this is fine. I'm fine because it feels so scary to do something that's different. But things are
Yeah.
going in one direction. Things are getting more corporate, more consolidated. It's not going to get better. It is not going to be better in a year than it is today. It is going to be worse. It is going to be way worse in 5 years than it is today. In my opinion, it's get out as soon as you can before it's like just totally too late.
I have such a patient-centered practice. My clients can reach me by email, they can text me. I have flexibility if someone's in crisis to see them. And it's, I didn't feel as though the systems were set up to be patient-centered or
Mm-hmm.
physician-centered.
Yeah.
And that's why I went to medical school. I was interested in what it meant to heal. And so what I've created for myself and my clients is healing. Thanks to you.
I appreciate that.
Yeah.
Maybe this will be a good like last question is like, what would you say to someone who's on the fence about joining the program? I'd say the other thing that when we talk to people considering joining is I could figure it out on my own. I could Google search it, which is true. Like you could Google search a lot. What would you
Yeah.
say to someone who's like considering just figuring it out on their own as opposed to paying for help?
I would say that it was reassuring to have your expertise. And then there were the additional bonus of being connected to a much larger group with a lot of resources available. So that was a really nice additional bonus. I would say it was reassuring to know that there was this larger group that would have my back in a way if I had
Mm.
questions. So,
Yeah.
yeah.
It can be lonely to do private practice because that's like the other thing that I think feels safer for people of I can walk down the corridor and talk to a colleague and run a clinical question by them. Whereas on your when you're in your own practice, you it can feel more siloed if you don't go out of your way to form a
Mm.
community. And so that's one of
Mhm.
the things I really try to create is this virtual community of everyone who's like-minded and doing the same things, where you don't feel like you're the crazy one who's the artist, who's interested in these ancient healing systems. You're like with 300 other people who think the same way and you can like bounce ideas off of them or just share wins or it's nice to connect with those people because or else you might be like in the regular world being like am I the crazy one, why is everyone else thinking a totally different way than I am? So I like to create
Right.
this curated space for like-minded clinicians.
Yeah. Yeah. Where you don't, yeah, I think you're bringing up something really important where it's lovely to not feel so censored
Mm-hmm.
by a system that's telling you, look, we want you to meet our quality metrics. We want you to meet our performance metrics. We want you to go to these meetings. And something that might reference ancient healing techniques or practices, maybe in
Mm-hmm.
some ways. And I'm not doing anything other than asking people to connect with their hearts, which is, and connect with the planet around them, which is what we could really use a little more of.
It's so awesome. I think this is going to be a really inspiring interview for a lot of people. Like I already have some people in my head I want to send it to. There's this psychiatrist with the golden handcuffs. And was there before we finish, was there anything else you wanted to add?
Yeah, I think you're one of the smartest people out there.
Oh, thank you.
Yeah,
Really? That's
I
so
think that you're doing a really great job. I think
nice.
that I feel really lucky to have found you when I did. And yeah, I'm really grateful to you and your program for helping me launch.
Excellent. I really appreciate you saying all that. I really appreciate you taking the time to meet. And then I will see you soon.
Okay, great.
Bye, Sue.
Bye bye. So nice to see you.